I suppose all of you here are gynecologists or doctors. Is that true? Majority. Yes. Yes. Okay. So you see, we practice every day, and while we practice, we many a times forget that we have a very tubular vision. We just look at the problem with which the patient comes, try to look into investigations for that, and advise medicine and send them away. The women in reproductive medicine are about 36 crores in our country, and we are about 45,000 gynecologists. We need to really give them preventive medicine. Why? Because if we can prevent some cancers, say, it will save lives. So our duty is not just to look at their disease and send them home as IVF specialists, infertility treating doctors, gynecologists, obstetrician. That is one opportunity we all have, if we can catch our patient there and educate them about what screening is available, what prevention is available for certain diseases which kill. And this is the only way we can empower our women, and we can also empower them in their reproductive field, and I'll tell you how. Like a small example is pap smear. I am an IVF person. Patients come with umpty number of failed IVFs. I just ask them, did you ever have a pap smear? No, madam. What is it? I want all of you to remember, and even I remind myself, that every patient who goes should be aware of what a pap smear is, which is for early detection of cervical cancer. And you know, this is the biggest killer of cancers in our country, because detection is late, treatment becomes very difficult, and the highest mortality is because of this. I want to remind you all and myself, don't forget to take one cervical smear for a liquid-based cytology and human papillomavirus. That will go a long way in preventing cancer in one woman. You have gained her life, her confidence on that. And you have to explain, it doesn't mean you have cancer if I'm screening. Maybe 1 out of 10 women whom I screen might show some changes which are treatable now, and you can be all right. Second thing is breast. We have 30% of breast cancers in our country out of all cancers in women. Can you imagine the magnitude of breast cancer? Self-examination. Every girl, any girl comes to your clinic, tell their mothers, they will teach the girl also. Please examine your breast, self-examine. If you find anything amiss, you can go for ultrasound at 40. Mandatory message should go to all women. A mammogram is a must. And once I'm sure you'll pick up so many small lesions which you have been able to prevent to grow into untreatable lesions. In USA, all men at 50 get a call, a mail from their respective healthcare system that you need a colonoscopy. Why is that? Because they can catch colon cancer at that age and treat it. We need to do something like that, and we as gynecologists should be the first to start advising whether you have any symptoms or not. The first mammogram should be between 40 and 41 years of age. Now I come to my own field, reproductive autonomy. What is reproductive autonomy? A girl is studying, she's making her career, and we say, oh, 20s and early 30s is the best age to have children. But why? Her colleague is working so hard. If she has the burden of a child, she's an educated girl. She wants to be the best mother to her child. But that age, that stage may not be right for her. So it is very good if we can make her understand that you do have a reproductive lifespan. The best is till 30 or 32. After that, it might go down, and you may not be able to have a child when you are ready to have one. So there is something like every girl around 30, whether she has a problem or not, just have ultrasound. Look at her ovaries, look whether she has enough follicles. Does she have a gynecological disease which will be difficult or which will make it difficult for her to conceive later, like huge fibroids, endometriosis, anything like that. And once you know it, she's aware, she will not delay her pregnancy. Every day I get a patient in my clinic who says, we are married for 8 years, but we are trying for 6 months. And now we found out that we have no ovarian reserve. What do we do? Why should a woman have to go through the mental stress of going for donated eggs? Or why should she have multiple IVFs to be able to retrieve that many eggs which will give her a living child? So now the third thing apart from breast and cervix, I would also want to add is reproductive autonomy is very important for all women, especially those who are aspiring for a career, who are aspiring professionally, and we need to do that. Apart from that, the cervical cancer vaccine. Vaccine people are advocating, most people know about the vaccine, but they don't know about the screening. So both the things have to be told to these patients. Even young girls between 9 to 14 can get the vaccine. It will prevent cervical cancer for always to them. We need the government to make it cheaper or free also, but at least screening is possible in women who are sexually active in our country. Apart from that, this is all about screening and prevention. Second thing is dispelling myths. What are the myths which are so prevalent? One woman told me, I'm not sexually active, I've never been married, why should I have a pap smear? So this is a myth. Every woman can get cervical cancer. The human papilloma virus can transmit through the skin. So you don't need to be sexually active. And hence, this is one myth which you have to dispel and tell them, even if you are not active, you have no symptoms. One smear will not harm you. It will give you a long time sort of comfort in your heart that nothing is happening. Same way, another myth is, I don't want to take oral contraceptives because I will become infertile. No contraceptive leads to infertility. Menstruation resumes, fertility comes back. So please dispel this myth. The Western world is living on. Why are we so afraid of them? Especially as gynecologists, we need to ensure if she's got a good ovarian reserve, her fertility is good, she can very safely be on oral contraceptive pills. This is reproductive autonomy for those women. I don't want to have a child now. Why? My husband is not ready to use a conventional contraception. A lot of husbands say, we're not ready to use a condom. Why will she not be on a pill? She must be on a pill. If her health allows, she's a non-smoker, which generally our women are non-smokers. So these are myths. Others are infertility treatment myths. First thing comes to me is, doctor, I have been resting because I am undergoing infertility treatment. Again, this is a myth. Please exercise as much as you can. Do Pilates, do yoga, go to the gym, run, walk. The more you exercise, the blood circulation is better. You are better oxygenated. Your reproductive organs work better. So there is no rest if you want to have a child, whether it is IVF or otherwise. Even in pregnancy, I want my women to be very active, to be going, walking. Impact exercises na kare, just make it you sort of thump on the floor. But even weight training is very good in pregnancy. I do not see anything. And read more, advise your patients. Take them off the bed at least. I would want every one of you to take the women off the bed. They must be working, walking, looking after their health. And we know lifestyle management, this is the most important thing which I can see. So we have to dispel their myths and tell them the truth. Then the last comes the patient-doctor relationship, the trust building. Today what has happened? The trust has gone away. So much of commercialization of medicine has happened. So many new things have happened that we really do not know that how do we get this trust back? One is listen to your patient very carefully when they are telling the history. Look into the eye of the patient. That will not only connect your mind with her problems, but it will connect your soul with her soul. And once the patient feels heard and connected and respected, immediately the partnership will grow. There would be a very good doctor-patient relationship. They will trust you, and whatever you tell them, they will trust that also. So let them be feel heard, and you answer all the whys they have. Every why should be answered. Every medicine which is written should be accountable. Why am I giving this? Will it serve the purpose which you have come to me for? and always try to write one medicine on a prescription. I always put a prize for my postgraduates who would write one medicine which could solve 2 or 3 problems for the patient. So it is so nice that you see less medicines. You have 6 medicines on your prescription. One is very important. Other are all supportive vitamins. What happens? What happens?
She takes supportive but don't take the important.
Correct. She will take the supportive and just leave the most important medicine away because she's tired by that time. My patients have been telling me after IVF, I've been given 15 medicines. I've set an alarm for every medicine. And by the time evening comes, I'm so nauseous that I don't want to take the medicine. So please be very cautious of this. Respect the patient's desire, her beliefs. Do not overload her with medicines. And once all this happens, I'm sure that the trust building will be there. One day we will gain the respect of our patients once again. Thank you very much.